My name is Brian Bailey. I've been doing counseling, training, consulting for the past 20 years in the King and Pierce County area. Been involved with a private practice for the last 8 to 10 years, working with all different types of people. Kind of specializing early on dealing with people with anger issues, people of color. Also working with the prison populations. Probation departments, different state entities, just talking about training, individual work, group work, just kind of doing the whole gambit of mental health work. Mental health means that it's a state of being, it's a state of healthiness, um, in the aspect of um, clear thinking, um, rational thoughts, being able to have a clear mindset and being able to look at things rationally without having the pressures of some disorder disrupting your everyday life. Very important. It's important for me to be able to function in life, to have a functionality. A lot of people are able to function with mental health issues, but it's at what level are you able to function at? So it's really important to figure out at what level you're able to function. A lot of us are walking around with mental health issues, but our functionality is lower than it could be if we were mentally healthy. Used to be historically sitting on grandma's porch, going to auntie or uncle to talk about your issues, or the black family, the African American family coming together and talking about dealing with uncle so and so, or or even the church dealing with sister so and so, or figuring out how we're going to wrap around or create community around that person. And as the black community, as we knew it, started to deteriorate, um, then the mental health, the circle that we put around mental health, the families and the community put around, began to disappear. So then there was a stigma around coming and sitting on the couch talking to a therapist, because that was a fairly unfamiliar way to deal with mental health issues in our community. So now moving forward, um, as we try to have especially more African American therapists to work with our community, hopefully we can pull the stigma back. I think some ways of doing it is just talking about it more. I think more people that are in therapy and are coming out successful and telling their brothers, telling their sisters, telling their family members, even in the community, really taking the stigma off by normalizing it, normalizing the being able to sit down and talk therapy. Um, I'm not sure if we're ever going to get back to the last generation or two generations ago when we were able as a community to do it, but hopefully we will be. But if not, we have to try to drop the stigma and kind of tear off the labels. Really, just sit back and take a breath, just breathe, and relax. A lot of our trauma comes in and it starts to affect our body. A lot of the stress, a lot of the anxiety really affects our body, which then will affect our health. I think breathing is really important. Also, to lean on loved ones, whether it's Zoom, whether it's on the phone, on the internet. I think, and even trying to normalize some of that, because in the beginning of the epidemic, it's really hard to Zoom meetings for a lot of us professionals. But as we've been through this 6 9 months now, it's becoming our new normal. I hate to keep using that kind of term, but to normalize things in a different way. Even as we people who are older can start to think about, and even younger, how the world evolved in the last 30 years, 40 years. We went from only using a wire phone to a cell phone to the internet, um, to now, from a block cell phone to 2G to 3G to 4G. Now we're into 5G. So just see this as an evolving factor when you're dealing with communications, and know that change, and believe, and really believe in your heart that change is evident. It's definitely going to happen, and embrace the technology and to connect, and don't see it as, oh, I can't. I know a lot of people that I'm working with are having a lot of anxiety and trouble, even depression, around not being able to see their loved ones that are in nursing homes and things like that. But I think it's an opportunity too for even our seniors, our elders, to be able to embrace technology and see and don't see it as some sort of prison, um, some sort of emotional prison or some sort of wall that's up, but see it as a way to connect. So basically, changing our thoughts, restructuring our minds to see this pandemic and the things that it's causing, see it as evolution, not as us having more blocks in our lives to see people and communicate. I think ways that we can work during this pandemic to alleviate a lot of the stress and strain is to just definitely think positively. Um, Throughout history, humans have always evolved to be able to handle and tackle pandemics, epidemics, wars. It's something that we've always been able to get past, and this won't be any different. Um, and sometimes just keeping that broad perspective on the world and how things work can help alleviate some of that internal stress, some of that knot in your stomach type of deal that's going on, along with all the racial tensions. With do some uh, positive self-talk, some forward thinking, seeing yourself past the pandemic, seeing your life when this is over, figuring out, think about what you're going to do after this is over, and don't get caught up in the everyday functionality of what's going on in this pandemic. Also, um, you can do things like, again, positive self-talk. Hey, this is going to be over soon. Hey, I'm going to get through this. We're going to get through this as a people. A lot of those things really help in trying to get past any kind of issue or any kind of trauma, especially when you're in the middle of a trauma. And truthfully, this pandemic is definitely a trauma, especially to the communities are being that are disproportionately affected by the pandemic. So I think it's really important that we're able to see ourselves past this. Bailey and Bailey Counseling here at the Rise Center, 2136 MLK in Tacoma on the Hilltop. But there are a lot of quality. I'm not gonna say a lot. There are a few. There are some quality, especially African American therapists in the area. Um, I would definitely look at Psychology Today. Um, look with your insurance carrier and ask your insurance carrier specifically for African American therapists. It's their job to find what you need in your area. So you can actually call your insurance company and say, hey, I want an African American female therapist, and this is my zip code. Tell me where all the ones in your network are within 20-minute drive of me. And it's their job to find those for you. So you don't even have to do all that searching and looking and all that. Call your insurance carrier. It doesn't matter if you're on state insurance, doesn't matter if you're on private insurance. Call your insurance carrier. It's their job to find those people for you. What they can do is also call 211 and talk about who does it, who takes people that don't have insurance. Um, Also, the majority of providers, even if you tell them that you don't have insurance, they have a private fee scale. It's called a sliding fee scale. So they'll see you for as low as who knows, but so don't think that because maybe you don't have insurance or your deductible is gigantic that you can't get mental health help, because most therapists have a sliding fee scale, and you'd be surprised the rates are affordable.